Hi there, how's it going? Nice to meet you. And today's video, it will be different. We'll talk about the renal ultrasound, fulfilling the desire of many of you. They ask for routine ultrasound exam. So unusually, today we're gonna use wireless handheld device from Eagleview, which is two probe coming together. All you need to do is to connect it with your smartphone. So let's start and do it. With the patient lying on supine position, we'll scan both kidney on the coronal and transverse view. In order to scan the right kidney with the coronal approach, we will put the probe at the patient flank at the lower costal margin, and then we will rotate the probe slightly oblique in order to get the kidney in the most longitudinal view. And also you can ask the patient to take deep inspiration and hold it. And this, it will help you to push the liver, diaphragm and kidney down in the abdomen. Take deep inspiration and hold it. Now here we have the liver as acoustic window to scan right kidney on the longitudinal view. The most superficial layer of the kidney, it will be the renal cortex with echogenicity that's similar or less than the liver, and in between we will see the renal medullary pyramid, which it will be hypoechoic compared to the renal cortex, and at the center of the kidney we'll have the echogenic renal sinus that containing fat. For image orientation, we have this diagram. At the ultrasound beam come from the lateral to the medial. If we turn this image upright, it means that on the top of the screen it will be lateral, and opposite to that it will be medial, as we are coming from lateral to medial. And as the probe marker toward the patient head, it means that the left of the screen, it will be toward the patient head, and opposite to that, it will be the feet. Now we will scan the kidney, try to looking for any abnormality. We'll ask the patient to take deep inspiration, and now we rock the probe back and forth in order to scan the whole kidney parenchyma. After that, we will rotate the probe 90-degree anti-clockwise, and now we have the kidney on the transverse view. And now as the probe marker is toward the bed, it means that the left of the screen posterior, and opposite to that it will be anterior, and we are still coming from the lateral to medial. Now we will survey the kidney on the transverse view, and we will ask the patient to take deep inspiration and hold it. On the transverse view, you may need to angle your probe and sliding the probe, trying to survey over the right kidney. So now we are survey over the right kidney, looking for any abnormality on the transverse view. And also you have to check the perfusion, blood perfusion over the kidney. And here we have the main renal vein and main renal artery. And also we'll check the perfusion over the kidney, and we have normal vascularity over the right kidney. Now we'll scan the urinary bladder by putting the probe at the mid-pelvis region. First, we'll start with the transverse view, and the bladder, it should be fully distended with urine in order to evaluate the urinary bladder wall. Then you have to angle your probe over the pubic bone in order to assess the base of the urinary bladder. Here in the transverse view, as we are coming from anterior to posterior, it means that the top of the screen, it is anterior, and the bottom of the screen, it is posterior. and add the probe marker toward the patient right, it means that the left of the screen, it will be toward the right, and the right of the screen, it will be toward the left. Now we will angle the probe 90 degree until we are sagittal, and here we are still coming from anterior to posterior, and the probe marker now toward the patient head. It means that the left of the screen, it is superior, and opposite to that, it will be inferior. Always keep in your mind that the left kidney is always superior and posterior compared to the right kidney, so that you may need to use an intercostal space approach. Sometimes you may need to use right lateral decubitus in order to eliminate the gases from the stomach and the intestine. That is it for today, and for more video, don't forget to share, like, and subscribe.